we're going to go over some different acronyms that's used in wilderness first aid and also used in urban medicine. The first is sample. You need to get a sample history on your patient. So the first thing that we look at is the signs and symptoms. So this S stands for signs, SX stands for symptoms. So a sign is what you see. You see that your patient is diaphoretic. That means they're sweating profusely. Okay? That is something you see. A symptom is what the patient feels. In other words, the patient tells you, I feel nauseated. Alright, that is a symptom. You can't see that the patient is feeling nauseous, but it's something that they tell you. The next letter in sample, it stands for allergies. This is any medications, foods, insects. So, you know, maybe it's a certain medication. Maybe they're allergic to morphine. Okay, certain foods. We're real familiar with food allergies. So, you know, maybe it's peanuts that they're allergic to, or insect bites, bee stings, ant bites, that kind of stuff is what we're talking about, allergies. The next that we have is medications. The M stands for medications. So we need to ask about over-the-counter medications. Have you taken any over-the-counter medications? OTC, over-the-counter. What about prescription meds? Have you taken any alcohol? What about drugs? You know, and they might be reluctant to answer this one to you, but certain drugs cause the body to do certain different things. So if they've taken one of these drugs and it has speeded up their pulse rate, and you're checking their pulse rate and it's extremely fast, and they don't tell you that it's due to a narcotic that they've taken, then that could be troublesome to you. And next is even herbal medications. They found out that some herbal medications do not act well with other types of medications. So these are the first three letters in the acronym of sample. Next we come to the P. This stands for pertinent past history. So this is where you're asking your patient, have you ever felt this way before? Do you have any problems with your heart? What about your breathing? Do you have any digestion problems? Do you have a history of seizures? Are you a diabetic? Okay, all these are very important questions. Then we come to the L in sample, and that stands for our last intake or outputs. Okay, these are our ins and outs. We want to know the quality and the quantity. So, when was the last time you've had anything to eat? And they tell you, okay, what was it? How much of it did you eat? When was the last time you had drank anything? When's the last time you've taken water? How much water? If they tell you I had an Nalgene, well, that's not being very descriptive, because we all know that there are different sizes of Nalgene containers. So you need to be very specific. Have you had 16 ounces? Have you had a liter? How much? A cup and a half? Urination. When was the last time that you urinated? What did the urine look like? Was it clear? Was it bright yellow? Did it have an odor to it? Defecation. When was the last time you had a bowel movement? Was that bowel movement normal for you? Vomiting. Did you vomit? How many times did you vomit? Can you tell me what was in your vomit? Was it just all clear, or were there different food chunks in it? That kind of stuff is what you have to ask here. Then the next that we have is the E in sample, and that stands for the events leading up to that incident or illness. You see down here it says cause of MOI. This stands for our mechanism of injury, and NOI stands for nature of illness. So we have trauma, we have medical. MOI, trauma. NOI particularly deals with the medical aspect of things. Next, we want to talk about dots. Did you observe any dots? And that stands for depressions. So as you're moving your hand down along their body, checking it out, did you come across any depressions? Did you see any obvious deformities? You know, both arms should look the same. Both hands should look the same. Both legs should look the same. One of them is more swollen than the other. So, or it's in a obtuse angle. Okay? Obvious deformity. What about tenderness? As you're touching that limb or that part of the body, are they tender there? Do you see any swelling? DOTS, dots. Also, note, are they pale, sweaty skin? Do they look nervous? Are they aware of what's going on? What's the position of the limbs that we see on our patient? Next, we go into our vital signs. This is very important. You need to make sure that you jot down the time and what these vital signs are, because this is how you're going to tell whether your patient's getting better or worse. The first time, record the time you took it. Their level of consciousness, LOC, or responsiveness, LOR. It means the same thing. This is just in transit. They're getting away from level of consciousness and going to level of responsiveness. So that's why both are there. Next, are they alert and oriented? That's what the A/O stands for. The 4 is the level. Okay, so the 4, they're awake, they're oriented to the person, place, time, and event. 4. Person, place, time, and event. ANO3 means they're awake and they're oriented, but you see we lose the event. So they know who they are, they know where they are, and they know about what time it is. Someone who's ANO times 2 means we're awake and oriented, ANO, and we're only that to person and place, so we know who we are and where we are, but you notice we lose time and event. The next is ANO times 1. This person's awake, oriented only to the person. So they know who they are, but they know nothing else. And then somebody who is ANO times 4, ANO times 0, that means they're awake, but they are not oriented, they're not responding appropriately to any type of questions that you might ask them. So, we have our very first in the AVPU, AVPU, AVPU scale. The alert and oriented, they're either 4, 3, 2, or 1. If they're none of those, then they're verbal. They're responsive to verbal stimulus. They're not awake. Response to verbal stimulus. So in other words, when you call their name, they respond. When you say, sir, can you hear me? And he's, okay, they're responsive to verbal. If you stop talking to them, then they do not respond. The next in AVPU is the P. It stands for responsive only to pain, okay? So that means this person, they're laying there, you talk to them, you scream at them, they do nothing. You inflict some type of pain to them and they respond. They jerk, they moan, they grunt, they do something, but they only do it to the painful stimulus. And then U stands for an unresponsive patient. This means that they do not respond to verbal or painful stimulus. They are certainly not alert and oriented. This means they are completely gone, that they are not responding to anything that you do. Okay, sometimes in the wilderness environment we have to make some very difficult decisions. These can be very highly stressful and emotional. This is your best friend. This is your wife. This is your child who is out there with you. It's just you and them. They are severely injured. They are too heavy for you to carry. You might have to make a decision to leave them there and go get help. you leaving them there, they might die before you're able to get back with help. So it is very important that you get medical training if you're going to be spending time out in the woods where you are more than an hour or so away from help. How long do you give CPR and try to save the patient? In a wilderness setting, if you've done CPR for longer than 30 minutes and there has not been any types of signs of life, body movements, anything like that to show you that they are alive, then after 30 minutes you are doing no good. And that's where it comes in that difficult decision. You know, I can tell you after 2 minutes of CPR, your chest compressions are no longer effective, and that is why we rotate out people doing compressions about the 2-minute mark, because we are not doing any good after that time. But there are some exceptions, except in lightning or hypothermia. With lightning, this is not, the heart has not stopped due to some type of disease process. It has stopped due to an electrical current going through the heart. So we would continue CPR on them, and you ask, how long do you do CPR? You do it until you don't think you can do it any longer, or you go just another 10 minutes or whatever. This is something that you have to decide on. And then on hypothermia, now after somebody has had a cardiac incident, like a myocardial infarction, so they've had a heart attack, EMS is actually inducing them into a hypothermia state and chances of saving them. So hypothermia, lightning, we go longer than 30 minutes. Okay. Next, move risk and further injury. Difficult decision. If they're laying there and you move them, are you going to hurt or kill them if you move them? Okay. And then the last one down here on the bottom is what I was talking about a while ago. You leave and go for help. They might die. They might get drug off by an animal in the woods. So it's very, very difficult decisions that you have to make. So you need to make sure that you're prepared when you go into the backcountry to be able to make these decisions. Next, we want to make sure we protect our patient from the elements. So if the ground is cold, wet, or hot, we need to get them off the ground. If it's starting to rain, do we need to get a shelter built? Do we need to create something for shade? Okay. If, let's say, we decide to set up a tent, you want to make sure you use their equipment, not yours. Because if you use yours, you no longer have it for your own survivability. So you have to use their stuff if they have anything, okay? But if you put them in a tent, is there enough room inside that tent for you and maybe another person to get in there and work on this patient? And is there plenty of ventilation? Okay? And wilderness survival, our priorities, number one are safety, shelter, water, and food. And, and it goes into the threes of wilderness survival, and I'm not going to get into those, but our personal safety, we're number one, our partner's number two, a patient is number three. Okay. And types of preparation, first off, you need the knowledge, you need to read, you need to get training. Okay. Next, we have our skills. When you get the training, you're going to learn skills. You got to practice those skills. It's like anything else. If you don't use it, you'll lose it. The next is equipment. You need to make sure that you have a good first aid kit or have adequate equipment with you when you go into the backcountry. And then the last is planning. You've got to have a plan. I'm going to stay here and treat the patient since I have the most medical training. You're going to go get help. When you make a plan, stick to that plan, okay? Alright, next is the patient assessment triangle. I actually saw this from Wilderness Medical Institute, and it's the best thing that I've seen, so props out to them on this. But the first thing in our triangle is our scene size up, okay? And this is where you're making sure that there's no type of hazards to you or any of the other rescues, okay? Are there any immediate dangers, to your patient, or, even to bystanders, Okay? Then the next is that we have to determine in our scene size up, we have these 5 things. Next, so first we have survey. Then the next thing we have is we have to determine our mechanism of injury or our nature of illness. Then after that, we have to establish our body substance isolation. This is BSI. This is where you're going to put on your gloves, maybe put on your rain jacket, maybe put on your sunglasses to protect yourself from any type of body fluids. Next is the number of patients, and you need to consider what kind of resources you have. Okay, and then next is your general impression. You know, is he very sick? You know, is he severely hurt? You know, maybe he's not that sick and he's not that hurt. But here's something to kind of help you remember the scene size up and the 5 things. Remember, I am number 1. Then you say, what happened to you? Then you say, nothing on me. Are there any more? And you're talking about the patients. Is my patient dead or alive? Next, we go into our life threats. And these are all what's called stops and fixes. Okay? And we're going to break this down in a little more detail. Then we're going to do a head-to-toe examination, unless this is a child. If it's a child, we're going to go toe to head, because if you start at your feet and work your way up to their head, they'll be more readily to trust you. That's on a child, of course. We need to get our vital signs. We need to get our patient history. We need to do our documentation, and we need to do our monitoring. Our scene size up. Check the scene. Is it safe? Method of injury. How did they get hurt? Body substance isolation. How many patients do we have? What's our general impression of this patient? Next, our stops and fix. These are, if you find something wrong as you're going through, you immediately stop and fix it before you move on to the next. So think of a stop sign, and then think about airway, breathing, circulation, disability, and environment exposed letters A, B, C, D, E around that stop sign. So first thing we need to do is we need to identify ourselves and our level of training. Hi, my name's Mike. I'm a paramedic. Can I help you? You just ask for the consent. They say yes, you help them. If they say no, you can't unless they become unresponsive. If they become unresponsive, then you assume that they would want your help. So next we establish responsiveness, and we do spinal control. So in other words, we're going to hold C-spine. We're going to hold their neck still and tell them not to move. Answer your questions, yes or no, not to move their head up and down. Then we're going to assess for verbal painful response. This is our AFPU scale. First, we're going to look at our airway. Okay, so think the top, the stop sign, the letter A, airway. Look in their mouth. Is it clear of instructions? Do you see broken teeth? Do you see blood? Breathing. Look, listen, feel. In other words, laugh at your patient. Expose their chest. Make sure they don't have any type of injuries. Next is circulation. We want to check pulse, check for major bleeding, control any bleeding we find, treat for shock. Disability. Maintain manual spine stabilization unless there's no mechanism of injury for the spine. Environment, we have 2 E's here, environment and expose. Environment is we want to protect them. If it's hot, cool, keep them cool. If it's cold, warm them up. If it's raining, get them out of the rain. If it's sunny, get them out of the sun. Expose, this is where you're going to actually remove clothing and look at their injuries. Okay, so if you're moving down checking their chest and you touch somewhere on their chest and they say, ouch, that hurts, you need to bare the chest and look at where you just touched to see if there's an injury. Okay, then we're going to do a focused exam in history. We want to inspect. Okay, so we look, we inquire, we palpate, it means we feel, we listen, and we check CSM. This is circulation, sensation, motion. And you do that in all 4 extremities. Can you wiggle your fingers for me? Do you feel me touch your fingers? Can you squeeze my hands for me? Okay, that's what CSM is. Patient head to toe. You're looking for any type of bruising, bleeding, swelling, a pain response, or anything out of the ordinary. Start at the head, face the neck. Carefully remove hats, helmets, sunglasses, etc. Run your fingers through their hair. When you do that, look at your gloved hands afterwards. Do you see blood? Examine their face. Press on all the facial bones. Ask them, does that hurt? Look behind the ears and behind and below. We're making sure there's no type of bruising indicative to a head injury behind the ears. We're making sure we don't have any type of body fluids or anything coming out of our ears. Feel along the muscles and the bones of the neck. Do you have any pain there? Do you feel something that feels like it shouldn't be there? Next we go to the shoulders. Check one shoulder at a time. Be sure to include the upper scapula. So you're going to put your hands front and back of the collarbone. You're going to press. You're going to check for stability. Okay? The clavicle. You know, it's one of the most easy or the most injured bones in the body. Feel of it. You know, make sure that it's not hurting. The upper humerus. Same thing for stability. You encircle the humerus. Push, pull on it gently. See if there's any kind of response. The chest. They're laying there. Spread your hands over sides of the chest wall. Start up high under the armpits. Have them take a breath in, breathe out. Is it painful? Look for instability and asymmetry on inspiration. So that would be indicative of a flailed chest. If one side goes up, the other side goes down, and they don't move together. Okay? Once high on the chest, once low on the chest. Ask your patient to take a deep breath. Does that hurt? Take your patient's arm, put it across their sternum, and gently press on their sternum. Do they feel any pain in their sternum? Next we move down to the abdomen. You're going to press on the abdomen with flattened fingers in each 4 quadrants. So imagine a line going horizontal and vertical through your belly button, and that will take you to the quadrants. Upper right quadrant, lower right, lower left, upper left, belly button, the umbilicus right in the middle. The pelvis. We can lose 3 liters of blood in the broken pelvis in no time at all, so it's very important. Put your hands cupped high on the hip bones, press down and in. If they have a fractured pelvis, as soon as you do this, they're going to scream bloody murder, okay? It's very important that you check this if you think they've sustained a fall. As you can see here in the note, your patient can bleed out in just a matter of minutes, and you'll never know it if they have this. If they have a busted up pelvis, they usually have what's called an open book fracture. When you look down at their feet are turned outwards like frog legs. The genitals. And here, inspect if there's a need. You simply ask your patient, is there a chance that you might have injured yourself there in your genitals? Does it feel wet? And if they say yes, or you see blood coming through their clothes in the genital area, then you need to take a look. Lower extremities, you're going to move down one leg at a time with your hands, encircling the extremity starting at the top of the thigh. And we're checking for stability. So we push and pull against our hands, moving down the leg, asking them the whole time, do you feel any pain? When you get down to their feet, you ask them to check the CSM. Wiggle your toes for me. Do you feel me touch your toes? Push against my hand. Pull against my hand with your feet. Upper extremities. So when we do this, we do one side. So we start at the head, we go down, we do, let's say, the right leg, and then we go across to the left leg, and then we start moving up our body, and we go right back up to the left arm, and we check just like we did before. One arm at a time, hands encircling the extremities. Check the upper humerus to the fingers. Check for CSM. This is also a good time to check to see if there's any type of medical ID bracelet. Next on your patient exam, your spine and buttocks. If the patient's laying down, protect the spine with a log roll. So in other words, you're going to roll this patient on one side. You're going to start at the back of their head. You're going to go all the way down to the bottom of their buttocks and look down the back side of their legs, checking for injuries. Check for bruises and other wounds. So in other words, you're going to have to expose some skin here. Reach underneath clothing to palpate the spine. So you start at the very base of the neck, and with your fingers, you start walking your fingers down their spine, looking to make sure that all the vertebra is lined up like it's supposed to be, and there's no kinds of step-offs. And then also, if they're pain, you know, if they are very tender, point tenderness to a certain area on the spine that you touch. So the general principles of a physical exam, our main thing is do no further harm. You need to be complete and systematic when you're doing this. Only one person does this, okay? Not two. Compare body parts. Look at the arms. You know, they should look the same. The legs should look the same. Make multiple observations, and very important, record your findings. You know, If somebody is seriously injured, you want to check them continuously every 5 minutes. If they're not seriously injured, then you can do your vital check about every 15 minutes. Our heart rate, this is our pulse beat. Normal is between 50 and 100 for anybody 12 years of age or older. We're looking for, is it regular or irregular? The quality, is it strong, weak, bounding, thready? You're going to check the radial pulse. There's other places to check, but the main pulse area that you want to check is the radial pulse. Next, our respiratory rate. Normal for anybody over the age of 12 should be 12 to 20. It should either be regular or irregular. It should be unlabored. It could be shallow, it could be labored, it could be deep, it could be rapid. So you just got to be very, very careful and make sure you describe it as best as you can. Our next is our skin color, temperature, moisture. We can be pink, pale red, blue, yellow. Ashen, usually in use non-pigmented areas. Ashen is going to be for people of color. Non-pigmented areas are like on the inside, lips. What is the temperature of the skin? Is it warm, cool, hot? Is it moist? Is it dry? Is it extremely wet? Pupils, when we check the eyes, we want to make sure that the pupils are equally round and reactive to light. We use the term pearl. And I've got here, no pupils are a late changing sign. There's an old saying, pupils are the windows to the soul, and I believe that with all my heart. On a pain scale, what is your pain level? Well, 1 to 10, 1 being the lowest pain level, 10 being the worst you ever had in your life. And to get from them, how bad is it? What would you have to do to me to cause me to experience your pain? And then note the area of pain.